Good morning, everyone. I'm Beth Smith. I'm part of the Good Practice team at Audit Wales, and you're joining us for the first session of our Learning Week. So today I'm joined by Rachel Rowlands. Rachel is the Chief Exec of Age Connect Morgannwg. She's also the Chair of Cwmtaf Morgannwg Regional Partnership Board and also the Protect Workstream Lead for Cwmtaf Morgannwg Test Trace Protect programme. So welcome, Rachel.
Thank you. Good to see
How
you
are you?
I'm good, thank you.
Good. So do you want to just give us a little sort of flavour of the kind of things you've been doing in each of your roles?
Yes, of course. So let's start with Age Connect Morgannwg, which is apparently my day job. But that's the day job, and that's, I guess, what in the early stages of COVID, the pandemic, that was kind of my primary focus, was making sure that the organisation was in a position to respond. I guess as the pandemic developed and into the summer, the TTP programme started and kicked off. The protect element of my current sort of workload became much greater. That there was obviously there was some fairly challenging targets to be met there in terms of delivering TTP, and I think that a pretty universal acknowledgement that the protect element of TTP felt like the most intangible, and so we didn't really have specific targets to meet. We just knew that we needed to make sure that people on the shielding patient list, for example, and other vulnerable groups, were supported to continue to self-isolate safely, and reduce the risk of becoming infected. So that all happened around the summer of last year and continues to happen now. And then with regards to the regional partnership board, in the current environment, I think what was interesting was our PB business continued. We agreed to meet virtually. We tried as much as we possibly could to continue with all of our transformation programme work and ACF work, but the reality is that a lot of those plans needed to be paused because there was so much redeployment of staff that would have otherwise worked on those new services and that transformation. So we're finding ourselves now in a bit of a reset place where we're sort of saying, okay, so what are we still going to be able to achieve within the transformation programme, given that we're into the final stages, I guess, and what will health and wellbeing services look like and social care services look like going forward in a post-COVID world. Does some of the stuff that we looked at and were living with pre-COVID, has that changed as a result of COVID naturally, organically, and not because of anything that we specifically did or deliberately did? And so do those plans still have all of those, that importance, and do they still need to happen in that way? So a huge kind of period of reflection and reassessment and planning and really thinking about this in a kind of recovery space, as opposed to a business as usual. And okay, so we had to stop there. Let's just start where we left off, because I don't think anything now feels like you can just start where it left off. Everything has changed. So and that applies to my role in Age Connect Morgannwg. The way that we've supported people over the last 12 months almost, has changed. Obviously, digital has become much more key, much more important, but also I think highlighted the inequalities, in terms of access to digital solutions and digital support. And even as an organisation, we realised that actually we were probably still a bit in the dark ages when it came to our digital solutions, and the way that we did things was very much face to face, very much in people's homes, and of course so much of that, almost all of it, had to stop. as a result of COVID. So a huge period of learning, I think. And that's one. I think that's one of the positives. And there are many positives to take away from the last year, but that's one of the positives I'll certainly take, is that it forced us to reevaluate and look at ourselves and take the opportunity to change for the better, really.
Yeah, I agree. And I think that's it's a common sort of response, isn't it, from most organisations. I think it was that opportunity to kind of look at what we were doing and actually push things forward at a much quicker pace. It's when you say as well about this feels like a time to sort of a reset on things and looking at what's going to be kind of retained for the future. We'll come on to that a little bit later, but just sort of taking you back now to sort of this time last year. Obviously we weren't quite in the first lockdown yet, but obviously a lot of things kind of going on in RCT, you know, the flooding and that kind of thing. So take us back to that moment. What was that kind of like, going through all that?
Well, so I mean, if we go back to a year to today, then first of all, none of us predicted that that RCT and Pontypridd and other areas in Wales, but certainly, we are based in Pontypridd. Our offices are in Pontypridd. Vast majority of our staff live in Rhondda and Taff, and none of us could have predicted that flooding was going to happen. So that really came as a shock on that Sunday morning when I had the call to say that the office was under 6 feet of water. And yeah, I think the first instinct is obviously to think about all of our service users, all of the people that we were currently supporting at that time, and try and find ways of contacting them to make sure that they were not in flood hit areas, making sure that they had the support that they needed. But of course, as everybody saw in the media, the communities right across RCT were just amazing, and it almost felt like a practice run. Now that we know what came a month after, it almost felt like as if it was a practice run for what was to come. So I guess when I was asked at the time, and people were obviously naturally, and we were very grateful for their empathy and their sympathy about what happened to us. But in reality, we lost desks, we lost computers, we lost chairs, we lost signage, we lost some leaflets and different things. But nobody lost. We didn't lose our home. We didn't lose our livelihoods. Our staff very quickly were back working. We had tremendous support from local organisations like Travalis. They gave us an office within the space of a week. They had us set up there. Our phones were redirected. Our computer systems were set back up, and we were back in business within a week. That wasn't the case for so many businesses in Mill Street and Taff Street and in Ponty Town Centre. Some of them are still not opened. They couldn't even get open by the time the kind of first lockdown came to an end. And so I think we were very fortunate, even though it felt devastating at the time. It did feel like as if it was almost like, I think I mentioned this to you before, in our previous offices we had had 2 fires, which makes us sound incredibly unlucky. We survived that, and we got through that, and then when the flood hit, we came back over to our offices, which thankfully are up on a first floor, and sat down and said, right, okay, what do we do now? How are we going to get our services back up and running as quickly as possible? And so we were having this debrief, and I said, well, guys, we've had fire, we've had flood, that's all that's left now is plague, but that's not likely to happen. And a month later, we were in the middle of a global pandemic.
Wow.
So I never joke about the Bible anymore. But it was a difficult time, but we recovered quite quickly, which I think is testimony to the staff and the trustees and the community spirit. I think dealing with the pandemic was much, much harder for a variety, because it absolutely affected everybody. Whereas when we were flooded, it was really, you know, the team that are based there every day. Our nail cutting customers, you know, couldn't access the service, but not for long. So in the bigger scheme of things, you know, it was I suppose disruptive for us, but absolutely devastating to so many people across RCT. And you know, when you look at organisations like Canolfan Pentra and some of the groups that in the Rhondda, up in, you know, that just, they were absolute superheroes. They were helping people find somewhere else to live. They were feeding people. They were helping them, you know, empty water from their houses. They were donating furniture for people who were going into temporary accommodation. And it was just amazing to see. Really, really amazing to see. And I think that there will be friendships and relationships forged as a result of the floods that will never be broken. You know, I think that community spirit is just so strong in those areas.
Yeah. So do you think then, obviously with that kind of community spirit you've talked about, do you think that almost gave you a little bit of a head start? I don't know if that's the right word to use, but in terms of when, you know, the pandemic started, were there already quite sort of strong links in place then for people within the communities, do you think?
Well, I think in the communities that were badly affected by the flood, then yes, I'm sure that you know, there was already, people were still trying to recover from all of that, and there was still lots of community-led action, you know, that was supporting local authorities and supporting public services. But I think you know, you know, people just did what felt right for them. And they did what they could, and they just did the right thing. And they didn't really need permission from anybody to do that. They didn't need to set up a group. They just knocked on the door and said, you know, I baked a cake, or, you know, use some bedding, or use some new towels, or, you know, everybody did as much as they could do. And when you add all of those bits together, that's what, you know, makes the difference, really. But I'm sure that it must have felt when the pandemic came along, and we realised the kind of, you know, the seriousness of lockdown, etc., and what that would mean. I think that for the communities that had been affected by the flooding, it must have just felt like, right, we just ramp up now, you know. We just dig in and we just keep going, because, you know, that's what communities like that do. They just dig deep, and, you know, and they just they do what they need to do. Yeah,
absolutely. So what would you say, what are you most proud of then in your response, do you think, to the pandemic, and I guess to the flooding as well that was experienced?
So I think from a point of view of Age Connects Morgannwg, so I think always, and I know that this can sound a bit like a cliche, but our staff are just absolutely amazing. You know, they are dedicated and genuinely, you know, the best ambassadors for the organisation. And they all pull together, all work as a team, all do, as I said, all do what they can with what they've got. And that creates, you know, wonderful teamwork. So I'm really, really proud of all of the staff, you know, in response to what happened with the flood. And I mean, and as far as the pandemic is concerned, you know, we were asking our staff to continue to support hospital discharges, and even when the infection rates in hospitals was really high, you know, we managed their concerns and their anxieties. Our staff, you know, without any hesitation, agreed to go and work in the step-down facilities in Abergarow Manor and Marsh House in Merthyr. Again, working in a relatively high risk environment, supporting patients that had been transferred from general hospitals. And so, they put their own sort of worries and anxieties about, becoming infected and maybe, passing on the infection. They took all of that responsibility very, very seriously and understood that, they had a really, really important role in setting an example. And they also, just did really whatever needed to be done and responded very quickly. And enjoyed it, actually. They were all quite sad to see the step down facilities go, and then they went back into their own roles. So I think lots to be proud of, and I think it is a sign, I think, of a strong organisation that, our staff, who are, let's face it, they are some of the lowest paid. We're not sort of paying our support workers and our community outreach team a huge amount of money. But actually, I think the support that they get from their colleagues, their peers, their line managers, from the senior team and the board, that added value is really important to them. So yeah, that's what I would say I was probably most proud of. And then with the TTP stuff, I think just, from a very selfish personal point of view, I'm proud that I managed to keep up with all of the science and the public health kind of environment that was very alien to me. And just trying to get my head around what some of the science meant and the data and everything. So huge learning opportunity that I hope I've done justice to, and that the work that we've done through the Protect Workstream has really made a difference to people in staying safe. And it has been challenging because we very often all of those messages about behaviour and compliance and doing the right thing, it's often coming at people when there are other messages through the media, etc., that are contradicting that public health messaging. So it's not easy to get the right message out. But I think perhaps one of the benefits of having like a lay person like me involved in that is that I'll often ask questions about what something means as a member of the public, and not as a public health professional or somebody that's really working on a daily basis in that environment. And we all know that when we're in work and we kind of, head down and everything around us sounds the same, feels the same, it's often not that easy to see it from somebody else's point of view who doesn't understand that information, and especially the level of complexity. I mean, I think not to underestimate that what we were trying to do through TTP was disseminate quite complex information and decision making in a really simple way, and I've absolutely been in awe of how the comms team do that, so it's been fantastic being part of that as well, and I'd like to think that collectively through the Protect Workstream, which comprises of the 3 local authorities across Cwm Taf, Morgannwg, the 3 CVCs, public health, and colleagues in the RPB and the health board, we've all managed to build this, really rich picture up of what community support is available to people that adds value to what support is available through the GPs, health board, NHS services, local authority, and really work together to develop a lot of that. And the self-isolation helpline was one of those products of that partnership work. So what we recognised was that for lots of people, self-isolation would be a challenge. they would potentially lose money because they couldn't work. It would potentially have implications for childcare. It would potentially have implications for their safety. So, and we recognise that when somebody tests positive or is contact traced, and they are contacted by the contact tracing team, it's an outward going call, and they're asked, do you need any support to self-isolate? And often that conversation comes quite soon, and they haven't had time to think about, well, what does this mean for me? How am I going to tell my employer? Am I going to lose my job? Am I going to lose money? How am I going to make ends meet? So we created, as a partnership, we created the self-isolation helpline, which gives people another bite of the cherry, or as many as they want. They could ring into the self-isolation helpline and say, right, okay, I've had a chat about, how long do I need to self-isolate? Is there any way I can get help with my finances? Is there any way I can get help with shopping because I've got nobody to shop for me and I don't know how to shop online, or I'm not confident to shop online? What happens to my children? Do my children need to come out of school now? How am I, all of these sorts of things. Yeah. And then the self-isolation helpline just basically pushes those inquiries out into the CVCs or the local authority or whoever is the best placed organisation to then provide that ongoing support. That's been successful, and I think that other areas across Wales have been really keen to replicate that, to meet their kind of local needs. That's been I'm quite proud of that as well.
Yeah, it's great because it's something quite simple, isn't it? But it's so valuable to people, like you say, kind of when you're in that self-isolation bubble, it's kind of, you just want to go to one place to find all that information because it's quite overwhelming, isn't it? And all these things you have to think about.
It is, and the one place that people do go to and is Facebook. Yeah. And if ever you want to get the wrong information, go to Facebook.
Exactly.
Yeah. Also trying to combat some of the misinformation, things like people saying, oh, if you contact trace, then and you just need to go, if you get contact traced because you've been in touch with somebody that is a positive, then go and get a test yourself, and if it comes back negative, you find you can go back to work. And that is not that was not the guidance, that. Yeah. So we were really trying to make sure that people got access to the correct information, at a time that was suitable for them and help them. And it so far, it's I think we've had over 3,000 calls, and lots of those relating to the self-isolation helpline as well. So, to the self-isolation payment, which obviously is really important for people who are on a low income, or will lose their money altogether. So really pleased that we were able to work together on that.
Yeah, brilliant. So kind of looking forward now then, and you started talking about this earlier. How do you think the pandemic will change some of the services you provide, and what do you think the biggest changes or takeaways do you think the pandemic's brought about?
Well, I mean, I've mentioned digital already, and access to digital sort of solutions, and I think that we recognise that as an organisation at Age Connect, we recognised that we needed to really improve the way that we use technology, not just to communicate with older people, but to communicate with each other as well. So, Teams, for example, Zoom, we'd never used any of these before this, and yet, presumably these kinds of online meeting platforms had always been around, but everything was always book a room, everybody drives there, and I think that's one thing I have missed. I've enjoyed and embraced the virtual meeting space, But I think there are certain things that really need to be done face to face with people, kind of creative work where you're, maybe exploring new ideas, or you're trying to work something through. It's very difficult to do in a virtual space. But so I think that from ACM's point of view, we are absolutely now moving forward with a really clear digital strategy about how older people can access our services via websites, via social media, but also still making sure that we are available for those people that don't want to use technology or can't, because otherwise we will just marginalize those people even more. But at the same time, we want to make sure that in 10 years' time, maybe when there's wonderful broadband right across Wales, and everybody can, and it's free, maybe, you never know. But certainly people have got access to the technology that they need. We want to be able to do business with them and to support them in that way. So that's something I'm looking forward to, is that. But I do still fear that actually we will leave some people behind if we see digital as being the panacea for everything. I think more broadly, and this is talking with perhaps my RPB hat on now, and I'm involved in the Together for Children and Young People programme. I'm the Workstream lead for the partnership Workstream there. So this is across the ages. What I really worry about is the long-term impact on people's mental health, and how we are going to be able to respond to what we would perhaps consider to be the lower level mental health challenges that we've all experienced through the pandemic period, and how our services, organisations, communities equipped to be able to support that, because they're not going to follow the traditional routes. So they're not going to, they're not going to be the kinds of it's not going to. Current mental health organisations are already overwhelmed and are probably, reaching out as far as they possibly can to tell people, if you need us, we're here. And I think right now, they probably demand on their support is increasing. And I think we've just got a bit of a time bomb waiting in maybe 12 months' time, where we have lots of young people that have gone back into school, that are, that have lost their connections. They've lost their friendship groups, they've lost all of those kind of safety nets that are around them, the things that they surround themselves with to make them feel safe and secure. A lot of that will have changed. We will have young people that will have lost their jobs. Maybe there's been changes in their household. Maybe relationships with parents will have suffered. So I think, not to sound too doom and gloom, but what I would really like to see is a sort of a 5-year recovery plan that, preferably that everybody can see themselves in. Every third sector organisation can see themselves in. Local authorities have got that, that clarity about where their role is, and that they get, the adequate funding to do that, and that we don't see the response to that as being, somehow a medical or a clinical solution. I think a lot of it rests with us in communities, and to not lose the fantastic work and connections and networks that now exist in communities that perhaps, have always been there in a way, but they always kick in when they need to. And I guess, let's just try and make sure that they are sustained in the way that they want to, so that people know that wherever they live, there's somebody close by that can talk to them, that can point them in the right direction if they need to go to a more, structured form of support. But I think mental health is probably on everybody's agenda now as one of the biggest concerns. Um, and the loss of employment for many people who would probably be considered to be less likely to find new employment. So I'm talking about people who are probably 55, 60 plus. If they feel that the job they left, they can't go back into another job like that, or the more similar job is very kind of digital and is all in a space that they are unfamiliar with, then that's going to put a lot of people off. So just need to make sure that those people get all the support they need because they want to continue to contribute. They have a massive contribution to make. Let's make sure that we don't leave those people kind of just drift off into unemployment unnecessarily, because I think that again that will have a massive impact on their mental health for such a long time. So that's all the kind of the doom and gloom bit that I think down the line. But I still think that there are huge positives in the ways that we demonstrated now across all the partners. We've demonstrated that actually when we need to do something quickly, we can.
Yes. Yeah.
And all of the bureaucracy in the world, it may serve a purpose in a particular time and place. But really, how important and crucial is some of that bureaucracy? I think that what we've certainly as a third sector, what we've done is that we've shown that we can deliver, overnight, really, and that where trust exists between partners, then solutions are very easy to find, and recognizing that there is only so much all of us can do, and that some of us are best placed to do things more than others.
Yeah.
But if we can all see our role in getting to the end game, and just let each other get on with it, then it can be a really meaningful and valuable experience for everybody. I think the community-led action that started with the floods and then just carried on going throughout the pandemic, vast majority of those community groups, they're not constituted. They haven't got a leadership structure. They haven't got anybody, they maybe have an admin, a Facebook group admin that makes sure that things are kept up to date. But in reality, it's just a group of really kind-hearted, energized, enthusiastic, conscientious people that are doing what they can to help, and that's fantastic. How do we sustain that, I think, is the question for us.
Yeah.
In that way, without forcing people into, well, now you have to become constituted, or now you have to be, you have to get a bank account, or now you have to do this. I think that what we've realized is that sometimes the greatest impact, it can be achieved by just lots of people doing the same thing, and not necessarily making them, sign up to volunteer with the organisation. Just, let them do what they can, where they can, with the people that they want to support, and that is a huge contribution in itself.
Definitely, I agree. And I think that's a perfect way to end things. So it's been so lovely to chat to you, Rachel. Thanks so much for giving your time today. It's been great to hear about all your experiences, and catch up and hear how busy you've been over the past year. It's
Yes.
lots going on. But yeah, thank you again, and hopefully it won't be too long before we get to see you in person.
Yes,
Um, but
indeed,
yeah, in the
indeed.
meantime,
Great to see you too. Thank you.